Hello again. This is Dr. Michael Agron, Dr. A. I'm your television doctor. This time we're going to talk about some interesting things that have happened in my medical career. I've got a million incredible stories, and I'm just going to start with a few short ones right now because I want to cover some other things too. But I want to tell you the story about a young girl that came in, and she'd been riding her bicycle one nice day, and a bug flew up her nose. Now that happens from time to time, and we see that in the emergency room from time to time, and it's really not a very terribly unusual thing. We have little kids that put BBs or candy or whatever up their nose, and it's just a common thing that we see, and we have a way to take care of it because most of the foreign bodies are too far up to grab with some tweezers. So we have a special catheter that we use. It's a thin catheter, and we put it all the way up through the nose past the insect, and at the end of the catheter we have a syringe, and then we inflate a balloon which is at the end of the catheter, and then we gently pull the foreign body out, the insect or the piece of candy or whatever the child has put up his nose. In this particular case, as we pulled this foreign body out, we were all shocked because it was a yellow jacket. The poor little girl was quite frightened. Fortunately, it hadn't stung her, and it would have been terrible if it did. She would have really swollen up. And it actually had drowned in the mucus secretions in the nose, so we were able to just dispose of it. But that's what happens when we have a foreign body up in the nose. We see this a lot in the ears, too. We have little insects sometimes that'll climb into an ear, or we'll have kids that put things in their ear. And we have ways of taking those out too. If it's an insect that's still alive and it scratches a little bit, it's very unnerving for the little kids. We lay them down on the bed, and we have the head up so that the ear that's affected is above. We then take a medicine called lidocaine, and we put drops of lidocaine in the ear, and lidocaine is an anesthetic, and it will kill the insect. It drowns them, and it also kills them, it basically poisons them for all intents and purposes. And then we sit them up again, and we use a syringe, and we just use tap water, and we just flush the ear out, and the foreign body usually just comes right out. There was one time when I did this, and it wasn't quite as routine as usual because the lidocaine did not kill the foreign animal that was in there. And it came running out, and it was actually a fairly good-sized spider. Now, the patient didn't see that, but it certainly shocked the nurse and myself when we saw that. That was fairly interesting. I had a lady once who had been swimming in the ocean in Baja California, and she got caught with a tide, and it bounced her against rocks, and it bounced her over and over and over and over again. Now, I didn't know what had happened to her. I just knew that she came into the emergency room, and she almost looked like a leopard. She had little bruises all over her body, and they're a few days old, so now they were kind of a golden color. So when she told me what had happened, she then told me that the way she got rescued, she said she was pretty much at the end of Baja California and was afraid she was going to get swept out to the ocean and never seen again. But she was able to cling on to one of the rocks, and finally some fishermen came along. And they were very careful coming out to get her because they were a little bit afraid that their boat would get pushed up against the rocks and they would all be in a pickle. So they reached this lady and they tried to start pulling her in the boat, but she didn't want to go into the boat right away because she said that the tide and all the bouncing around had made her lose her top. But of course, these guys didn't want to die either, so they grabbed her and brought her into the boat. So fortunately, when I saw her, she was not in any serious shape. She had not broken any bones. There were no cuts or lacerations that I needed to sew up. But it certainly was very interesting to see somebody like that. Another interesting story was one time I went in to see a lady, and when I asked her what her problem was, she had said, "Well, doctor, I have this strangest thing. I want to have sex with any man that I see." Now, I was the only man in the room, and of course that made me a little bit on the nervous side, so the very first thing I did was turn right around and go out and get a nurse to come in and stand right next to me so that we didn't have any problems in the future. But that's the first and only time I ever had that story. Another interesting story was I was working one day, and this young kid came in. He was probably 11 years old, and he had a big black eye, and he is with his mother, and they said they had that he had hit his head on the door jamb. Well, about an hour later, after this patient had been discharged, a man came in, and his hand was swollen, and his finger was broken, and it turns out that he said he had punched his son in the face because he had been being bad. So that's really what had happened. We call that a boxer's fracture, by the way. This bone right here is the fifth metacarpal, and when it breaks and you take an x-ray of that, you can almost tell that the patient has punched somebody or punched a wall, and the patient has a boxer's fracture. Let's talk about something medical, and that will be snake bites. The summer is getting hot, and snakes are starting to come out, especially rattlesnakes. Now, rattlesnakes usually will warn you because they don't want to strike, they want you to just go away. And if they rattle, you just need to stay away from them. But sometimes you'll get bit even by accident. An example I had once was a young man who was in a stream, and he came to rest, and he reached his hand over his head onto a ledge, and he put his hand down, and he put it right on a rattlesnake, and he got bit. Now, we also have people that have been drinking too much alcohol, and they antagonize the snakes, and we see that from time too. I had a very interesting one once. I had a gentleman who had Alzheimer's, and he came into the emergency room and said he'd gone out to the trash, and he had been bitten by a bug. And he kept telling me over and over again, I got bitten by a bug. But I could tell that it wasn't a bug, it was a rattlesnake. And the way you can tell is you can see the puncture wounds, and usually it gets white or blanched around the puncture wounds, and then it starts to swell. And the swelling starts to go up your arm, higher and higher. And then the other thing that happens is it affects your muscles, and your muscles start to twitch. That's called fasciculations, and the muscles will start twitching. So this gentleman had the swelling and had the fasciculation, so even though he couldn't really tell me what had bitten him, I knew it was a rattlesnake. What we do is we get him to the emergency room as quickly as we can, and then we skin test them with the antivenom, because there's plenty of antivenom that we can use to take care of rattlesnake bites. And then what we'll do is we'll start infusing the antivenom. And if the swelling keeps going up the arm, they'll get admitted to the hospital, and they may need treatment for just several days, to be honest with you. And it's a good thing to get to the emergency room as soon as possible. You can die from snake bites like rattlesnakes, but most of the time, if you get into the emergency room, everything is going to be fine. Now, the question has come up sometimes about sucking out the venom. Make a little incision where the fangs have penetrated the skin and suck the venom out. That was something that was thought of as an idea many, many years ago, and it has been discredited, and so you don't ever have to do that. The main thing that you do is you want to get back to the emergency room as soon as you can. Some people have advocated that you put a tourniquet on the arm and compress the blood vessels, the arteries and the veins. And then that turned out not to be such a good idea. And then they thought maybe put on a light tourniquet so that you're just compressing the veins going to the hand. Keeping it elevated is probably a good idea, but the main thing is you've just got to get to the emergency room, because the antivenom really is the solution for a rattlesnake bite. I got an email recently from a gentleman who was out hunting moose, and he was just outside of Nome, Alaska, and he had a rash on his arm. He thought he had probably brushed up against something and wondered what he could do. It was probably poison ivy or poison oak, because it was a rather itchy rash. And the thing that he could do is take Benadryl, which is over the counter. You can buy 25 milligram tablets, and you can take those. If you have to, you can take 2. The 50 milligram pill is actually a prescription amount, but you still can take 1 or 2 Benadryl tablets, and it usually helps substantially. The thing that you have to think about, however, is it will make you sleepy, so what you don't want to do is drive or do anything dangerous, and certainly don't climb on any ladders so that you might get hurt. And one thing I want to tell you about rashes in general, it's almost a joke, but it's really true. The joke is that if the rash is dry, you want to wet it, and if the rash is wet, you want to dry it. And there's a lot of truth to that. You can try to take care of your rash by yourself, whether it's with the Benadryl or trying to wet it or trying to dry it. But if you don't get better in 2 or 3 days, you need to go see your doctor, because I can only give you general advice, and you need to see your own doctor about any of your medical problems like that. But I'm happy to take care of people like that are asking for advice, because they are so far away that they don't have a hospital near them. These remote hospitals have very limited services. Some of them are closing. They're struggling financially. So if you need help, just go ahead and email me, and we'll see if I can answer some of your emails on our show. Let's switch topics a little bit here. I am kind of a collector. I told everybody I'm addicted to auctions. Thank goodness that's the only thing I can think I'm addicted to. And I pick up all kinds of things at auctions or at swap meets. I actually was at the Rose Bowl swap meet, and I bought a couple of these. These are bones from a bison that's extinct and 12,000 years ago. And this is a tibia. So here's the tibial plateau. You see those two bumpy things right there? And then this is the bottom of the ankle. And these are very interesting to me. This one I varnished just so that it would look a little bit better. But that's what this is. It actually has a break right through here you may or may not be able to see on your screen. But that's a tibia from an extinct bison. So those are the kinds of things that I like to collect. I collect a lot of old things. I have something else here I'm going to show you, and we'll save this one until next time, and I'll tell you what this is. But I'll let you think about what this item is right here. I've shown this to many doctors. Many of the doctors can't figure out what this is. Some of them can. So I'll discuss this next time for you. Okay, let's keep things light, and let's go on with the joke of the day. I want to tell you about this elderly couple. They're both 92 years old. They're driving down the road, and the car goes over the side, and it rolls over and over and over again. Next thing you know, the gentleman wakes up in the emergency room, doesn't know where he is at first. He looks down, he's got plaster on both of his ankles, he's got cuts all over, he's scraped up, and he looks around and realizes he's in the hospital, and he says, "Oh, but where's my Ethel? Where's my wife, Ethel?" The doctor says, "Well, Ethel made it, but I want you to know she's hurt really bad, worse than you. I want you to know that she's confused, she yells all the time, and she's incontinent of urine. You're going to have to put a diaper on her, and this is going to be something you're going to have to do about 6 times a day. It's going to disrupt your sleep pretty much. She's going to need medicine every 2 hours that you're going to have to give her on a very careful schedule. And you're going to have to hand feed her, you know. And she's got a colostomy bag, so you're going to have to have to get rid of all of her poop. And it's really pretty sad. It's pretty sad." "Oh, no," he's crying. "I can't believe it. This is going to ruin my life. I'm 92 years old. I can't believe it." The doctor says, "Oh, come on. I'm just kidding with you. Don't worry. She died." So I kind of thought that was a cute joke, and I thought I'd pass that on to you. If you have a better one, send it in to me. If you want to talk about anything else on this show, about things that are odd that you collect, about medical issues, free stories, what happens in the emergency room, what happens behind the scenes, anything that tickles your fancy, please feel free to write in. We've had quite a bit of mail so far. We'll get to all of it as soon as we can. Please feel free to subscribe, tell all your friends, and in the meantime, all of you guys have a wonderful week, and enjoy yourselves and stay happy and healthy. And this is Dr. Michael Agron, Dr. A, signing off. See you now.